Okay, number 6, support the healthcare workforce. So having workforce safety, morale, wellness is necessary for providing safe care. What we actually have been saying is it's a precondition to providing safe care. Unless you have staff that are physically and psychologically safe, or caregivers who are physically and psychologically safe, they are not going to be able to take excellent care of our patients. And so our caregivers really need support. And other industries figured this out long ago, but unfortunately in healthcare we seem to have not paid as much attention to it as other industries. No other industry would tolerate the rates of harm that we tolerate in healthcare. So we also talk a lot about joy and meaning. So in the US, there's a lot of conversation around burnout, and everyone's saying we need to reduce burnout, et cetera. And to me, reducing burnout, the absence of burnout should not be the goal. The goal should be joy and meaning, because that's why we went into healthcare in the first place. So the absence of burnout is a low bar, and our vision should really be around joy and meaning. And so getting back to the safety piece, though, it's inextricably linked, and unless caregivers are given the protection and support and respect they need, they are more likely to make errors, fail to follow safe practices, and not work well in teams. So we need to have the workforce safety piece there, and then there's other pieces as well that need to come in to create that joy piece, and I'll show you a framework that describes that. So this is going to be very hard for you to read, and it comes from OSHA, which is, I'm going to forget the acronym, what it stands for. Anyway, the organization in the US government, Occupational Safety and Health something, that tracks workforce injuries in the United States. And what's important here is the blue line is across all industries what the injury rate is, and the red line is healthcare. So in the US at least, healthcare is more dangerous than mining, manufacturing, or construction. Which when you say that to a healthcare audience, they actually don't believe me, and I have to show these statistics. But it's more dangerous than all of those other industries, 30 times higher than some other industries. More days are lost to occupational illness and injury in healthcare compared to some of those other industries that we traditionally would have thought were high risk. But those industries have realized their most valuable resource is their people, and they need to keep their people safe. The last statistic is often very telling. A nurse or physician has a 5 to 6 times higher chance of being assaulted than a cab driver in New York City. And that's physical harm, which is really important, but there's also psychological harm that we know occurs in healthcare. Lack of respect, discrimination, lack of support, lack of appreciation, the production pressures, the time demands, all of those things that ultimately can be contributors to burnout. So there's interesting work going on to try to think about how do we change the tide on these rates of harm that are occurring. Kaiser is a big system in the United States, and they have created this workplace safety index, which has 4 questions. Came out of the world of manufacturing and Alcoa that was using these kinds of questions. So the 4 questions: necessary steps are taken in my department or work unit to ensure safety. My immediate supervisor recognizes me when I do a good job. I'm provided the resources I need to do my job, and the people who I work with treat each other with respect. So a lot of psychological safety questions in there in terms of recognition and respect. And so they combine the scores of these 4 questions to create their workplace safety index. And what's really interesting is if a unit scores in the top 20% on that index, their injury rates are 83% lower than if you're in the bottom on that index. Now, what I find interesting is the questions are about psychological harm. The injuries, this is about physical harm, so there's a correlation, at least, between scores on that psychological harm survey and rates of physical harm. And so what Kaiser's doing is doing the survey, identifying those units that are in that teal color, making sure it looks teal up there, that are in that teal color, and they're actually going in and trying to do interventions to improve those scores and hopefully prevent some of the both physical and psychological harm that is occurring in those places. This is our framework for joy in work, as I talked about. You can see that the physical and psychological safety piece is just one piece of the pie. It's a low bar. It's a low bar to say we should not get harmed when we go to work. But we need to actually meet that bar, which we're not doing right now. And then there's all these other pieces that are going to be critical to get us to the joy piece. And things like recognition, things like teamwork, things like better engagement with our patients, wellness, all these other things ultimately will hopefully get us to that level of joy. One last thing I'll share here, there's some organizations that we're seeing that are not saying patient safety or even person safety anymore. They're just saying safety. The person safety would probably work in the sense that they're not separating the workforce safety from the patient safety. They're putting it all together. So this is an example from Cincinnati Children's, and they have a pyramid of harm, and any level of harm that they're talking about, they have measures related to patients and measures related to staff in all of those, because they don't want it to be siloed, they don't want them to be separate, but they want it to be a very comprehensive picture of the harm that's happening in their organization.